I've been watching with some excitement what's coming out of ESMO, particularly the results of the Adriatic Study, which was also published in New England Journal of Medicine at the same time. In the Adriatic Study, patients with limited stage small cell lung cancer underwent chemotherapy and radiotherapy, as well as PCI at the discretion of the investigator. They were then randomized in a 1-to-1 fashion between one of three arms. This was the first interim analysis of the study and found significant results between up to 24 months of durva and placebo, and thus was reported out. Here you see the radiation therapy details from the study. Patients could either get 60 to 66 gray in once-a-day fashion or 45 gray over 3 weeks delivered in a BID fashion. Again, as I mentioned before, PCI was at the discretion of the investigator. When you look at the patient characteristics and demographics, you'll notice that about half the patients were from Asia, 70% got once-a-day radiation, 2/3 got cisplatin, and a little bit more than half got PCI. The results are rather impressive. As you can see, at 24 and 36 months, the use of durva had a 10% increase in overall survival. The subset analysis I'll get to in a little bit. What's also important to notice is that the side effects were pretty minimal, except for a little bit bump in the radiation pneumonitis that we'll talk about in a bit. I prefer to just call it pneumonitis. I follow TND on Twitter, who's part of the BTOG. Say that 3 times real fast. But he posted some interesting tweets that I found of value to review. What you can see is that carboplatin was associated with a increase in survival compared to cis. And whether you got durva or not, it seemed to be beneficial. The patients who got PCI also seemed to do better compared to those patients who did not get it. And lastly, what you'll see is that the patients who got BID radiotherapy also had better outcomes compared to the once-a-day radiation therapy, regardless of the use of durva. I think the message here is pretty clear. Durva led to significantly longer overall survival and progression-free survival. And similar to Pacific and non-small cell lung cancer, the adverse events are minimal. I'm looking forward to hearing more information about this study as it will be presented at a plenary at the upcoming ASTRO meeting. Thanks and stay safe.